Good morning, everybody, and welcome to Weekly Wake Up. This is Boulder Valley School District's opportunity to talk to employees on a weekly basis about things that are going on in the school district, big initiatives, COVID-19, reintroduction, etc. As you know, on Friday, Governor Jared Polis announced during his weekly press conference that Colorado educators will be moving up when it comes to vaccinations. He once again prioritized public education and announced that student-facing educators and staff would be eligible to get vaccinations beginning a week from today on February 8th. That's exciting news, and I'm pleased to have partners from public health back with us again to answer some of your questions in regards to the situation. I do want to remind everybody, as always, that we do accept questions during the show. We did get a number of great questions after we put this out last week. If you have something that you want to ask, you're welcome to send it to us via bit.ly. That's bit.ly/BVSD Wake Up. And I'm going to go ahead and take this off the screen here and introduce who's with us this morning. First and foremost, again, from our partners with Boulder and Broomfield County Public Health, Chris Urbina, our Health Medical Officer. Hey, Chris.
Good morning.
Good morning. I know Chris Campbell's going to be joining us. He's the Boulder County Public Health.
Who's there, Randy?
You are here, Chris. Good morning. How are you?
Doing fine, thanks.
You just slipped right in right when I was doing that introduction, and I didn't see you walk in. Sorry about that. Rob Anderson, our superintendent. Good morning, Rob.
Morning, Randy. Good morning, everyone.
And then Margaret Crespo, one of our three amazing area superintendents. Good morning, Margaret.
Good morning, everyone.
And then we've got Stephanie Farron, our Director of Health Services. Good morning, Steph.
Good morning.
And last but not least, Mike Rados, the Assistant Superintendent of Human Resources.
Good morning, everybody.
Good morning. All right. So again, we are accepting questions, and I do want to just take a moment, since Dr. Anderson was able to join us today, to just kind of get his take on things. We had heard some rumors that this was coming, and then on Friday, afternoon, it came true. And we did get, I did want to mention that we got a number of emails from our teachers. One after the email said, "I'm so excited to get my vaccine. Tears of joy when I read Rob's email." So, honestly, I know a lot of people are of the same thought. One more layer of protection is going to be excellent for educators. Why don't you tell us a little bit about, what your thoughts were after you heard that announcement on Friday, Rob?
Thanks, Randy. Really excited. It's just a testament to our governor. He has consistently thought about public education during this pandemic, consistently has worked towards prioritizing schools and public education. And he's done an incredible job. If you think about the CARES Act dollars that he's freed up to our districts to make sure we're able to operate, the free testing that he's provided through COVID Check Colorado, and now for some districts through the Binax testing. And then the prioritization of educators. So first of all, my first reaction, incredibly excited. I think the second reaction is, okay, how are we going to make this work, right? I mean, we've got a week to be able to make sure that we have all of our systems in place, that we can begin to start vaccinating on February 8th. I know that we've been working very closely with our partners in public health. You'll hear from them today. I can't tell you how amazing they've been through all of this. And I also can't tell you how stressful and hard this will be to try to pull off. Let's just be honest. I mean, and I think I've said this and been pretty consistent. The thing that is going to hold us up isn't our partnerships with public health, isn't our ability to be prepared. It's going to be the availability of the vaccine, right? Now, luckily, from the governor's press conference, it seems like the Biden administration has been transparent in, the vaccines that we'll get in weeks to come. Which is great, right? It seems like that for the first time since this pandemic, since the vaccines have started, the state has the ability to begin to predict how many vaccines will be coming in on a weekly basis. Right now, we still have to make sure that we're prioritizing those individuals in our community that are 70 and above. And from what I understand, we have a pretty long way to go there as well. We may be about 45% of the way there in regards to making sure those folks have been vaccinated, and they're a priority in our community as well. And so excited that teachers can begin to join this prioritized group on February 8th. Governor has set an ambitious goal of 3 weeks. I think that is optimistic, and certainly we look forward to being able to do everything we can to make sure that our teachers begin to get vaccinated. But I also know and understand that this is going to be a really big undertaking. And so we're just going to have to wait and see. But we're excited, Randy. I mean, that was a long answer to your question, but it is early. So I want to try to get my energy up and give you a good answer. So.
No, I appreciate that. And I appreciate you mentioning, the Biden administration and what they've been talking about. I know our governor and now the president has talked about, really trying to make sure that K-8 and public schools in general, are sort of at the top of the list. And I know a lot of folks have wondered, do you think that this will change things in the district? As we've been working to try to keep kids in school now that we have some of these groups, back. And then, the question always is, present of, when will we be able to expand that in-person learning opportunity especially for our secondary students? What are your thoughts? What would you like to share?
I would say as the vaccinations come in, it's another additional strong layer to not only our district's response, but our community's response, right, to this pandemic. It can only help us to increase the number of in-person days that we're providing. Again, but I think that there's, over the next month that we'll learn a lot. I think we're going to learn a lot about this variant. And, there's mixed opinions on what's going to happen, how that's going to impact us. I think that, the fact that we were able to start in-person school on January 5th, and we've been able to not have to close a single school, right, is a testament not only to our partnership with public health, but to the mitigation efforts that we've put in place, right? When we shut down in November, which was incredibly difficult. I think everybody knows and understands that. We went to work. We got classroom monitors. We got air ventilation. We had health monitors. We increased testing, and I think all those things are working really well. So we have to continue to watch to make sure that the cases are staying low. I just want to thank everybody who's watching in our community that's helping us do that, because that's really where that happens. I do think that community cases is a primary driver of being able to be in person. Right. And so as you have vaccines, right, what's going to happen ultimately, you hope that continues to push down those community cases, and then we'll be able to maintain. So I think we're going to learn a lot over the next month or so. I think, some neighboring districts have said, well, once teachers are vaccinated, we should be good to go. And I certainly hope that that's the case. However, we just, we want to be, if I've learned anything during this pandemic, it's just, let the information come to you. Don't try to get ahead of and try to be Nostradamus and try to predict the future, because it won't go well. We just have to make sure that we're being mindful and that we proceed in just a really thoughtful manner. Right. There's a lot of people counting on us to make sure that we're making really good, smart decisions around this. And I don't feel the pressure to have to rush those decisions. I think that we just want to make the best decision with the information we have. So I think we're going to learn a lot over the next month.
Yeah, obviously there's a lot of, and I know Chris and the two Chris's, we're going to talk a little bit about kind of what we're looking at right now. But we have variants that are just making an emergence now in our community. We don't know how fast the vaccinations are going to go out there, and so I know that we've kind of taken the approach of navigating this with the information and the best guidance from our partners in public health. When we think about that opportunity to come back, we are planning for these things right now. I mean, we're thinking about what that looks like. We're thinking about, far into the future. And I'd love to have you just chat about, beyond just the coming back to school, which again would be a collaborative process with our employees. The idea of, we're also thinking about the impacts that this is having on our kids and trying to make sure that we're taking care of their needs, beyond just this time, and how do we catch them up, right?
Absolutely. I mean, I think that, we have to navigate this pandemic. And as soon as the pandemic subsides, we have another challenge, right? Which is, where are our kids academically? Where are they socially, emotionally? As we plan for, what I hope is a fairly normal return in August of 2021 to school. And I think that, with vaccines and the rest of this year, I think that's what you're probably looking at this point. We can't go back to the way that we looked 2 Augusts ago when we came back to school, because our needs are going to be different. You're going to have schools that have never had the amount of kids behind that they're going to be facing. You're going to have kids that were behind that are even more behind. And I think that as we are thinking about what do we need to do, what are the systems, structures, supports we need to put in place in the district office to set our schools and our teachers up for success, I think that you'll be seeing a lot of things that are going to be continuing to roll out over this spring semester. Fortunately for us, our strategic plan is going to serve as a guiding light. And so as we think about, how do we do a better job of prioritizing standards and supporting a district-wide multi-tiered system of supports? How are we going to create additional opportunities for kids to have instructional time so they can accelerate their growth to be where it is that they need to be? I do think that we have a lot of work to do this next spring in working on that, and so more to come on a lot of those things. But we certainly have to be thinking forward in regards to how do we adjust our system to be there for our kids and our families who need us.
And we are so thankful to our employees, to our teachers, to our staff for everything that they've done. Are there any final thoughts that you want to share as we move on in this conversation?
And absolutely, and I think I'll pick up on that point. Our employees have been incredible. Our teachers, bus drivers, folks in our custodial department, those that are in food service. Over the past year, just incredible efforts. I'm so thankful. Our community is so thankful. We have amazing people. It's the strength of this district. It has been. It always will be. And so just a heartfelt thank you. And then just stay tuned in regards to vaccines, right? I think that the hard thing about the vaccines, and we've seen this since a certain school district made an announcement prematurely in December. Folks in our district feeling we're getting left behind. What's happening? You'll still see some of that. I think that I would encourage people not to turn to social media for their news sources. To engage with us, ask the tough questions. We'll answer you. I can tell you that we're in constant communication with not only Boulder County Public Health, other school districts, the governor's office. I mean, we've got our finger on the pulse on what needs to happen. And we're going to start February 8th. We're going to work hard with our health partners and health providers to get as many educators in as fast as we can. And so hang in there with us. If you have questions, talk to your principal, talk to your supervisor. You can email any of us. We'll get back to you as quickly as we can. We're excited. Again, thank you to the governor. When I talk to superintendents that I know from across the country, I can't tell you how proud I am of how the state of Colorado and our school district have been able to respond. And I know that for some folks it's too much and some folks it's not enough as you talk about in-person learning. But the way that we've come together, the way that we've used data and science to make these decisions is in comparison to other places across the country, our kids are getting and families are getting incredible support. Our employees are getting incredible support. So just really proud of where we are, not only just in the state, but from a perspective across the country. So just really proud of where we are, and just a final thanks to everybody. Thanks for waking up so early to join us.
Well, thank you, Superintendent Anderson. I really appreciate you joining us this morning. And I do want to give, again, our public health folks a chance to kind of talk about what the situation right now is. Chris Campbell, I think you've got a few slides to show us, right?
I do. Yeah, good morning. Thank you, everyone. And I'll work on presenting here. Let's see. Make sure I do this right.
We can see you.
Okay. And again, my name is Chris Campbell. I'm the emergency manager with Boulder County Public Health. I just wanted to mention before I get started here, I was able to present to the Board of Education just a couple weeks ago. And I just want to thank and just let the group know I have boys in the district. My boys are at Community Montessori in 3rd grade and 1st grade. And I just wanted to thank this group and everyone that's on the call today for their leadership and partnership. It's simply been amazing, and I'm proud to be a part of that. And I will echo everything that has been said here with the partnership, and that's really going to be a focus today, and how we're going to continue to navigate both the vaccine administration with this group, and really where we're at currently with the disease in our community. So, as was mentioned, I think it's really important to frame our conversation with the picture in the community. So I'm going to go through some data, and then Dr. Bina is going to talk a little bit about the variants we're seeing across the country and what that means for the Boulder County community. And I will discuss a bit where we're at with vaccines. And this is just to show where everyone's at in terms of the dial and our indicators that we look at around the community that really shows the impact of COVID in our community currently. And we are in a positive trajectory. We're currently in that high risk category, orange category on the dial. Our positivity rate is in a positive place, which is good, and that's a testament again to everything we know the community is doing that works with masking and distancing. So again, it's a message you're going to hear from us repeatedly. You've already heard this morning from your leadership, and something that continues to be very important. Hospitalizations additionally continue to decline in the county. And we're looking at that. We continue to keep an eye on that incident rate, which is about 288 per 100,000 of cases in Boulder County. That continues to go down. We'll look at some additional slides as well. We like to look at some trends within the metro region. This might be hard to see on your screen, but Boulder County is in the red there. And we continue that downward trajectory, which is very positive. We're past the holiday season, potential surges, which is very positive. And what that means is we continue to need to be vigilant as a community and do everything we know that is working to keep everyone safe. Again, looking at those reports of testing positive, those daily numbers. I know this probably is hard to see, but again, on a very positive trajectory. These data sets are ones that we like to look at in terms of trends through age groups. One we're looking at here is that age group of 18-year-olds to 22-year-olds, and moving up just a little bit, and one we want to keep an eye on moving forward. Again, this is just looking at our positivity rates in the county, which remain low at 4.1, 3.6 to 4.1%. Again, a very positive trend, but one we have to keep an eye on as a community. And I'll briefly just touch on and shift gears a little bit on where we're at with vaccines. This was as of last Thursday. We're just making steady progress, as the leadership mentioned here. So about 18,000, community members have received that first dose of vaccine, and we're now really rolling into that full course or 2 doses, which is very, very important. So again, those numbers, certainly need to grow as we continue to work on this vaccination campaign. And this shows some of the progress we've made over the last 6 weeks. As many of you know, there was a shift this last Friday from the governor's office in the phase distribution plan. I think Superintendent Anderson stated it very well, that there's some work to be done here, and we will work very closely with this group, with the leadership at the district, to ensure a smooth rollout of this vaccination campaign, to really look at vaccine allocation across the county, get those systems and partnerships in place to really vaccinate this group. So we're excited to move that direction, and there's a lot of work to be done, and we're having those conversations currently. One important thing, and again, Dr. Anderson mentioned this, and you've heard this from some others. We still have a little ways to go with that 70+ group of community members. We've made good progress and have vaccinated about 45% of our community members that are 70 years old or older, which is very, very important, and we still have a little ways to go. We are in the metro area. The other counties in the area have a little ways to go as well. So if you look at that data, they're about 31%. The reason we show this is, and again, this message, we want to make sure or be very transparent about the need to be patient as we roll this out. We're getting a better understanding of the vaccine allocation and transparency on all levels. On the national level, which has really helped our state do additional planning and understand a consistent vaccine supply. That number is going up, but it's still not where it needs to be. Even as early as last week, we had a very small amount of vaccine that came into Boulder County, and that was really challenging. We had 800 doses of vaccine coming into Boulder County last week. Thankfully, the numbers are looking much higher moving into the next week, about 7,000 vaccines coming into Boulder County. That probably will be a little more consistent, and we will make progress as a community as we see that vaccine allocation go up. Again, full transparency with the group, and the challenge is going to be just to be patient, diligently work through these groups of community members, and knowing that there's nothing more that we want to do as Boulder County Public Health, but vaccinate this group, vaccinate all community members, and ultimately we will get there. And I think I'll leave it at that. I just wanted to provide some additional information. And maybe Dr. Bina, if you could talk a little bit about your thoughts on the variants that we're seeing with COVID, that would be helpful.
Glad to, Campbell. You know, when Chris and I are both at the same presentation, instead of saying Chris, we say Campbell and Urbina, just reference, because we don't know who's going to answer the question. Would it be helpful, Superintendent Anderson and Randy, to talk a little bit about the variants? Do you want me to do that now?
Yeah, I think that would be great, Chris.
Okay, so let me just reinforce a couple things as we go forward. And you'll hear me say this now, and you'll hear me say it after the discussion around the variants, is that our protection that we have in place right now in the schools, that you've done an excellent job of doing, you know, the mask wearing, the physical distancing, the washing the hands, the disinfecting surfaces, the increased ventilation, you know, the cohorting of groups, all of that is extremely protective and important. And Randy and I have had this discussion about the layers. And I think the superintendent, Dr. Anderson, talked a little about adding this extra layer of the vaccine. So it's important that we continue to have those things in place and not say at this point, well, when we get the vaccine, we're going to be okay, because we're still going to be in the same boat for a number of months. So I think wearing those things are still important. So that's my segue into the variants. And because the variants haven't changed our protection strategies, and it would be important to that, because it's still spread respiratorily and aerosolized, wearing a mask, you and your students and your other fellow teachers at home and at school, still protects you and others from the virus, regardless of what variant it is. It doesn't matter. So that you still need to use protection. And so I know there'll be questions about 2 masks, and we can talk about that as well. All viruses change. This virus is no different. It mutates. And as it replicates more and more, if you go back to your biology work a long time ago, they replicate millions of these things. And so you're going to see it change. And so it's not surprising that we're seeing variants emerge. It's not surprising that we're seeing variants emerge. Now, the significance of these variants is the issue. And let's talk about the significance. One, are they more infectious? Can they spread more? And we'll talk about that. Are the prevention strategies that we're using protective? Can they cause either less or more severe disease? Are the treatments that we're using less or more effective? And finally, does the vaccine protect us against those? So you seeing in the national media, and I appreciate Dr. Anderson saying get your information from us rather than the media, because I think you do get lots of misinformation out there. So let's talk about the current variants then. There's a UK variant you've heard a lot about. That's the one that started in England, and they believe it's largely responsible for their big outbreak, and that is true. That UK variant is probably more contagious. We don't know how that works. It's probably related to the respiratory epithelium in your nose or in your lungs. That's probably more sticky, but that's significant. And so that change that's happening on the spike proteins around the virus is important to understand and important to watch. Now that we've discovered that we've had over 10 cases of that UK variant in Colorado, but it was probably always here, it's important to know that we still need to pay attention to that. And so far, we know it's here, and even though because we don't test every genome, and I can go into specifics about that, it's important to know that the virus is changing and the UK variant is here. And if it's more contagious, we need to really double down on all our protection strategies that I talked about earlier. So the next issue is around whether or not it is our protection measures are in place. And the answer is yes. If you use those protection measures, you're going to protect yourself against these. And the other issue is, do they cause more severe disease? Well, if we have more virus, this is part of the issue in not understanding whether or not it's more severe, the UK variant, is if you have more cases, you have more hospitalizations, and you have more deaths. So it's hard to separate whether or not this is because it's more contagious and we have more cases, Is that the cause of its more severe disease? Well, there's some preliminary information that the UKA is probably causing, UK variant, it does cause more severe disease, but that's still a lesson we're watching. So the third issue is whether or not our current medical treatments are effective, and the answer is most of them still are. Remdesivir and the steroids certainly work regardless of what the virus infection you have, but the monoclonal antibodies, just think about this. Remember, we were given serum to these, the folks who had the recovery. Well, that monoclonal, that antibody that was produced by somebody who had had the previous infection may not be as effective as against the new variants. Now, Stephanie's shaking her head, which I think is right on. She understands this, is that if you have an antibody to a virus that was different than it is now, it may not be as effective. But it's still effective, but not as effective. So that's important to point out. And finally, the issue around vaccines. Because as all of you know, here in this Zoom meeting, as well as out in the community, that the vaccines were studied with people who had exposure to natural infections. So the tens of thousands of people that volunteered for these studies, both Moderna and Pfizer, these variants were floating around the world already. So there is some protection against these new variants because people were exposed to them naturally. So they're probably, early on, the studies with Moderna and Pfizer showed that they were 94 and 95% effective. They're probably still that against the original virus, probably less effective against the new variants, but less effective is still good. So it's 89% effective. Well, that's still good. And some of the new vaccines that are coming out, you see this in the paper, well, the single dose Johnson & Johnson one is now only 70% effective. That's still darn good in terms of adding another layer. So I don't want to say, well, I should get only the Moderna and Pfizer. No, that's really not reasonable thinking. You should get whatever vaccine is available, you should get, because that's going to add to the protection of you and out in the community. So there's some evidence that the South African virus is in the United States as well, and that's the one we're most concerned about regarding its susceptibility to the vaccine or protecting you with the current vaccines. It's also some early evidence that it may be more severe and more infectious, but we're watching that. And finally, I want to say, and I know there are going to be questions about this, is that what are we doing? Well, the state is currently doing about 200 samples a week looking for the genomic or the genes part of this change of these variants. So we're watching very closely to make sure that the variants are not expanding in Colorado. But it's likely, if we can't get the virus under control with all the prevention strategies and adding vaccines, then the virus is going to continue to mutate and we'll have another variant in the future. I don't mean to be doom and gloom, but I think I'm just calling it what it is, and we have to protect ourselves with all the strategies that we have in place. So I'll stop there. Probably talked a little bit too long, too much information, but I'll be happy to answer your questions about any of the vaccines or the variants.
Well, Dr. Urbina, I really appreciate that, because I do believe that is one of the big questions that we've had out there right now is, is this going to be, are these things effective when it comes to these new variants? Because, as they take shape in the community, that becomes sort of a fear. I did want to ask you before, I'm going to be going to Stephanie Farron here in a second to kind of talk about BVSD's plan within sort of this network of things as these vaccines are being rolled out. And if you want, as you know, I'm an analogy guy. And so I always try to think about this stuff is flowing, through these pipelines into states, into counties, and, certain rules are being taken into effect. So then once it gets into the county, the plan is essentially, we're going to continue to be trying to serve those 70-year-olds and older. We're going to be then, trying to serve some of the district staff. And then in that arena, that's something that we'll be responsible for. I don't know if that's, which Chris is better to answer this, but am I thinking about that correctly?
I can take that one. Thank you, Randy. That is absolutely right. And again, a lot of details will be worked out. But we will encourage, all the staff there on the call today to work with your district, and they're going to be working through the plan. They already thinking a lot of ideas, and that's how you will access the vaccine is through the district.
Perfect. Thank you. So to Stephanie now, the immediate question that came to people's mind is, what do I need to do? Do I need to go sign up somewhere? What's the process? And can you just give us a little bit of an overview of what we think is going to happen here?
Sure. Good morning, everybody, and thank you, Dr. Urbina and Chris. Really appreciate you being able to give that perspective on kind of where we are and where we need to go. We have actually been working through this process with our 1B above the line folks, which is now 1B1, I believe. Is that correct? And, the process actually has worked pretty well for us. Folks who were identified as being able to get the vaccine in that group were provided a link to an appointment setup site. We supplied that information to the employee, and then they actually went and signed up through, in this case, most cases, it was Safeway that we were working with. Our understanding is that it was a really good process. Folks were able to get in. They needed to bring the letter that they got in the email through us, as well as usually their ID from work. And they got their first vaccine and were able to make an appointment for their second vaccine. We anticipate that that'll be the exact same process moving forward. We're not sure if that'll be through Safeway or another community provider. That's something that we're going to be talking a little bit more with public health around tomorrow. But we anticipate it'll be that same process. So employees will get a notice from us that it's their turn to go and sign up for an appointment, and they'll have all the information that they need to do that.
One of the questions that we got was, will this be first come, first serve? We've also gotten a lot of questions in regards to whether or not we might provide priority to certain groups. For instance, let me get to the right page here. The idea that, I'm considered high risk, age, how much they're in the classroom, all these kind of factors are things that obviously people are asking about and suggesting, hey, is it possible for me to get moved up? And so I'll give you one of these examples. I'm considered high risk. I have a chronic pulmonary and respiratory issues, surgery removed part of my lung and diaphragm. How do I become a prioritized employee for a vaccine ahead of teachers and staff that may not be high risk or have health issues? What kinds of things are we thinking about as we might be trying to kind of get this organized?
Well, one of the ways that we've looked at kind of putting our list of staff together and who goes first and how we move down through that process is really based on the CDC and the state's recommendations. So we're looking at age first, health conditions, folks from racial and ethnic minority groups, how much people are interacting with students. You have to be a forward-facing staff person in this group of 1B.2 to be able to receive the vaccine. We're also anticipating that there could be some guidance coming out from the state around that as well. So we have already kind of put together what we think would be a good prioritization list and some categories, and then we're waiting to see what comes out from the state to see if we match up with that or if we need to do some altering.
And I do know that, one of the questions that's come up, quite a bit, partly because of the governor's language, we took right out of his press release, a little bit about what he envisions in terms of who's in person. But I do want to make sure that we specifically address this. Part-time teachers, will they be included in the round of vaccine rollout? Because I think one of the things that it pointed out was full-time. I believe that our thought is, if you face kids, and it, we've gotten obviously the question, and as we have from the beginning about, are we talking about bus drivers? Are we talking? I mean, you could go down every different list. We've heard from everybody asking, paras. The answer is, if you are facing students, if you are working with students, absolutely, right?
Yeah. That's exactly how we're reading it. Absolutely. We know that we need our staff in schools, and we want to make sure that anybody who's working with kiddos is able to get the vaccine. That's how we read it, and that's how we are interpreting this. Yes.
And again, this might be too far into the weeds, but we have gotten questions like, are folks that are, have to touch multiple cohorts, would that be something that might be prioritized?
I don't know.
Okay. And again, this is pretty early on. We've got some of the big thoughts, and so
Yep.
we'll be working a lot on that. So,
Yep.
and I do want to, just say right up front that, again, the announcement came on Friday. We've got the big system in place, and a lot of these little smaller questions are still being worked out. So
Yeah, they are.
for both us and public health. I do want to go back to a question, again, you were kind of talking about the process that worked up to this point when it came to our 70 plus and those health related, workers, those people that were in 1B above the line at that point. What did that look like in regards to it? A question that we got was, how exactly will teachers be notified about the COVID vaccine? Sounds like BVSD will be notified via email when it's our turn. That's essentially how it worked before, and
Yes.
all the information was in there in regards to what to do next, right?
Yes. That's how the system worked with this initial group of folks that we were able to provide vaccine appointments for. At this point, that's how we anticipate it moving going forward as well. I also see Chris Campbell shaking his head. This is all so unknown right now. It's really difficult to give. And I certainly don't want anybody to think that any kind of an answer is 100%, because everything is moving. It's still a moving target. The health departments found out the same time that we found out. So we're all kind of pulling back together again and looking at how we're going to do this moving forward. But that's what we anticipate, the same process.
I would just like to add to that. And so we, our goal is really to leverage. We have about 33 providers currently, which have been amazing. So this includes all the hospitals, the pharmacies, some pharmacies in the county. We talked about King Soopers and Safeway, our federally qualified health centers, which are Clinica and Salud. So the idea again is to most effectively leverage those partners who have pretty good capacity. We, with that group, if we had enough vaccine, could provide 20 to 22,000 vaccines a week. So that the system is built there. It's far from perfect, and we will admit that there is some challenges with sign up. I think what is great about working with the school districts is we, your staff well, you're able to communicate with them well. So we will. Our goal is really to connect this group with a very clear process and provider, and then you should again receive clear information as a staff member where to go, when to sign up. But our goal again as a group, and we've had commitments from the very start, from this leadership, from all the leaderships with our providers, to coordinate and work well together so we can equitably, throughout that system we've built, provide vaccines. So again, we're still working through, we even still have some healthcare workers, those moderate risk healthcare workers that are still trying to get vaccinated. Again, we got 800 vaccines in the community last week, which was really challenging. So it's that act of trying to equitably pair someone with a provider. And I think what we'll see as the groups start to open up and we see more and more vaccine, there's just going to be ways that community members can go to sites to sign up, and there'll be less of that matchmaking. But currently we're leveraging those partners and making sure there's clear handoffs to groups to get vaccinated so there's no confusion.
And I really appreciated you earlier too, talking about just the idea that, again, from public health's point of view, we want to get everyone vaccinated. And, from a school district point of view, of course, if the world was everything that we'd want it to be, if it was our hopes and dreams, we would have enough vaccinations to just have everybody be able to do it at once. But the way that this has been working, as we've seen in news coverage, is really that a hospital may get a batch, and so you've got this and you got to work through that in a certain amount of time. And so really you're trying to kind of hunt and make sure that you've got, the vaccine where it's at. I do also want to just, sort of touch on that we and the governor have been pretty upfront that the focus of this next group is really about those student-facing employees. We do know, of course, and the idea being that we really want to keep our schools open and expand those opportunities because we know how important in-person learning is for our students. Some of our teachers, of course, are an exemption because of health-related concerns, and we've been asked questions like, I am currently exempt and teaching from home, but my doctor has told me that I can safely return to the classroom as soon as I get the vaccine. Am I able to sign up for the vaccine with other teachers in February 8th? Mike, I know that we've been working to work with teachers that are in this kind of situation so that they can make that transition. Do you have any thoughts in regards to how that will work?
Yes, so we have been working with that process. And one of the things that Stephanie, I'll add to what she said, because she said it so well, is that employees will also be getting a message, a voicemail from School Messenger to look at their email when their vaccinations could occur. So it gives them that message, plus they go to email, and then it goes through there. But the people that are exempt, yes, we're looking at that as to whether or not we can do that. I know the guidance says in front of students. So that kind of puts a little caveat in there about where the requirement would be, but we're trying to figure that out in terms of we could have exempt teachers come back. We want them to come back if they agree to come back after they're exempt, or I mean, after they're vaccinated. Yes, we really want that.
And so I guess maybe one of the other questions would be, the full effect of this, at least with the 2 vaccines that we have in hand right now. And again, you mentioned, Dr. Urbina, you mentioned the Johnson & Johnson one that's only 1 dose. But for most of those, this is a 2-dose situation. Hypothetically for those and again, I might be going into an arena that we don't know a lot about, but I'll just pose the question. For these teachers that are looking to come back after their, because of health concerns, would it be after that 2nd dose, after a certain amount of time? I think I remember you saying that at one point.
Great question, Randy. And that's what people are asking right now, is that when can I go back and not have to worry about the same precautions? And the answer is you should always worry about the same precautions. And I don't want to give people the impression that all of a sudden, now that you're vaccinated, that you can go back and not wear a mask and physical distancing, et cetera. I know I'm harping on that, but it's critical that people understand this, that this is another layer of protection. And yes, to answer your question directly, for the Pfizer and Moderna vaccines, you are not protected until you get the 2nd dose, and you wait 2 weeks till after that 2nd dose. So that's a period of, for the Pfizer vaccine, that's 5 weeks, right? If you get the Pfizer vaccine and then get your 2nd one 3 weeks later, then that's 2 weeks after that. So that's 5 weeks. For the Moderna vaccine, it's you get your first vaccine and you get the 2nd dose 4 weeks later, you have to wait another 2 weeks. So that's 6 weeks of getting full protection. Now, what does full protection mean? Full protection means that you are going to have less severe disease if you come in contact with the virus. You still could potentially get the infection, but it'll be mild. You still could potentially share that infection or spread that infection. So it is possible. It's not, no vaccine is 100% of protecting the infection, but it's another layer. So I think people need to understand that vaccines are going to be helpful because with all the other things, they've add more protection. And then as soon as there's no more susceptible hosts out there, that is, everybody's protected or everybody's vaccinated, then the virus truly will decrease or change enough significantly, it'll be a different disease process of that in the future. So I think that's our current thinking. And as you know, as Dr. Anderson pointed out earlier, the science is always changing. And hopefully I won't be that different in when I'm talking about this in March and April. But we have to pay attention to that. We have to pay attention to the data and the science. And that's at least our current thinking about how this process, if protection or immunity, is going to happen. Now we're learning natural immunity probably lasts longer than 90 days, but we're still talking about that natural immunity as being an important factor in terms of increasing everybody's immunity.
That herd immunity is so key to what we're talking about here. I do wonder, I think part of where this comes from as well is this conversation that is, I think the state's changing its guidelines so that, once we're an educator, once they have vaccination in place, that they potentially won't have to quarantine. So again, we're kind of playing with the information that we have at this time. Maybe play is not the right word there, but utilizing the information that we have at this time and trying to utilize that, or at least the state is, in order to sort of, again, allow schools to stay open. But this is something that we'll start learning quite a bit about. Am I accurate in that?
Yes, absolutely. And that's why these conversations, and that's why Campbell and I came on, is that we want to provide the most up-to-date information to share with your staff and your teachers and your administration so that we're all on the same page. We're trying to be as transparent as we can, and that's evolving. We have to be honest about that, and we have to be honest about the number of vaccines that we don't have, as much as we have of the vaccines that we do have.
And I know that that has been one of the more frustrating things, is that as things evolve, people will look back at some of the earlier conversations on this. So I will just say that we appreciate you being here and just providing what you know at the moment. And in 2 weeks from now, who knows, things could change significantly. I do want to get back to the idea. So for teachers that want to stay on, on their exemption, obviously we honor that. We understand that, to Chris's point, that, they might not feel comfortable, and the layers of protection that they have, at least for the time being. If that's the case, then they would be, considered, and maybe I'm talking a little bit outside of what we know at this point, but, and maybe this is a question more for the Chris's, but as part of the next layer in the community, as we're looking out in there, or how, that is there a layer of high risk that plays into that decision of where people fall into the general population as well? Does that make sense?
Not yet. Maybe you can clarify what the question is.
It wouldn't be student facing because they're teaching from home.
Okay.
But essentially, they are at high risk. So of course we're very concerned about their safety, in the community. How will that work?
Sure, I got it. Thank you for clarifying it. So let's define what high risk is. And I think this is very important to be clear about this. Everyone who hasn't had the infection or who hadn't had the vaccine and waited 2 weeks afterward is susceptible to the infection. Everyone is susceptible to the infection. So I think people say, well, I'm high risk. Well, if you take precautions, if you do remote teaching or you wear a mask and you physical distancing, don't go large groups, you are essentially protected from getting the infection. So it doesn't change. Just because you're high risk or you have a medical condition or you're elderly like myself, it doesn't change that I should still be wearing my mask. So still do that. When we say high risk, means that if you get the infection, you're at risk of complications from the infection. So that if you have a lung disease or heart disease or immunosuppressive disease like cancer, or you're on immunosuppressive drugs, then you're at greater risk of getting complications from the infection, maybe hospitalized, and potentially a higher risk of dying. So it's not risk of getting the infection, it's risk of having complications if you get the infection. So what we're trying to do for people in the community, 70 plus, first line folks that are on the front lines of taking care of patients that are COVID-19 are at greater risk or greater susceptibility of getting the infection. And those folks who are with 70 plus who are at greater risk of having complications if they get the infection. That's why we started with those folks first in terms of getting the infection. Now that the teachers are eligible, which is great, we hope that a lot of them take those takes the chance to get the opportunity to get the vaccine. And I really like what Stephanie said earlier. It seems like the prioritization within the schools, your guys are thinking about that in the right way. So I support that. That makes sense to me. So that you put those folks in front of the line who are facing the students, facing each other. But we're still going to, if you're remote learning and you're in those high risk categories, we're still going to encourage you to get the vaccine wherever you get it, whether or not it's at Boulder County with public health, or you get it from your doctor, or you get it at the school systems. We're still going to encourage you to get those vaccines.
Yeah, I think that's really important to say, because I know that out there in the community, there's been that sort of question, both with our staff as well as just generally, that if you have an opportunity, if you're 70 plus and you can put in for your own healthcare provider, if you can put in through the hospital, I mean, it doesn't hurt to play all the different routes in case, one becomes, again, our main focus is to get you in. So I appreciate you saying that. So again, let me go to the next question here. I guess, Chris Campbell, is there anything else that you want to say in regards to that before? Okay, perfect. I just wanted to make sure. There are, of course, plenty of questions in regards to the vaccinations themselves. I think you did, Dr. Bina, you did kind of address this earlier. It sounds like there will be 3 vaccines available to the public. Some of the questions that we've gotten are, from our staff are, will there be a choice of vaccination? What if I'm not comfortable with the vaccination that's offered? I just got one in the box here that said, I'm afraid about getting the vaccination because there hasn't been enough testing. What would be what you'd like to say to folks in regards to the situation with the vaccine?
Sure. I think read the information. There is plenty online. If you want to go to our website, bouldercounty.org, we have, or the CDC or the state website, there's plenty enough information about each of the vaccines. Each one has their story. Moderna and Pfizer are both mRNA vaccines. They've been scrutinized. They're both safe and effective. And so I think people need to understand, and that there's doubt out there. I get it. And there are people that are saying, well, I don't want that foreign substance in their body. And that's a choice they may have to make. They have to weigh the choice of getting the infection. No one wants the infection in their body either. And if they can decrease their likelihood they're going to get the infection with a vaccine, I would say, but read about it. There's lots of information out there. The newer platforms, the AstraZeneca, the Johnson & Johnson, are both adenovirus vector, where they carry that protein around the virus itself. So it stimulates your body's immune response to make antibodies and other immune system factors to control the infection. So those are safe as well. So nothing is released to the public, even under emergency use authorization, even under EUA, that is not safe or proven to be safe to the public. This gets very careful scrutiny. I had already my first dose of Moderna, and I had a little sore arm, but I haven't grown any hair or an extra eyeball, and my DNA has not been changed at all. And those are the questions we see on the internet a lot. And I often answer those questions by saying, you're getting misinformation. This is the information that you need to hear, and then make your choice. Read about it. I often say, I have a fireside chat in one of the other counties I always end the talk by, spread the information, not the infection. So I think those questions that your people have are reasonable questions. Get them answered, and then take the vaccine. And it really doesn't matter which vaccine. I would take the first vaccine available. If you can get the vaccine, get it.
Perfect. I think this is along that line. I know that we have seen some news reporting in regards to that second dose, there being some symptoms, side effects, that kind of thing. What do we know about that at this point?
Sure. And again, these are new vaccines. And remember, they were studied over months with tens of thousands of people. In the two studies enrolled, there were 70,000 people that are enrolled in both studies, half getting the placebo and half getting the vaccine. And what they discovered was that in the first dose, the people had a sore arm, sore shoulder, sometimes people had fever, chills, sometimes had other side effects like just feeling lousy or a headache. But they noticed that also in the second dose, they had a greater response. So they had their arm was a little more sore. They may have had fevers or chills, but all of those side effects resolved within 48 hours. So I think people should expect that those side effects are going to happen. And then when they do happen, they say, well, that's just my body's immune system responding to the infection. And then it goes away. And you can handle it with a warm compress, taking acetaminophen or ibuprofen. And then if there's really concerns, then obviously talk to your doctor. But we've given how many doses in Boulder County, Campbell?
About 23,000 first and second doses total.
So in that 23,000 and millions in the country, there have been the same side effects have been noted, and so there are no serious complications. And to the best of my knowledge, no one has died from the infection, despite what you hear on the internet. Hank Aaron did not die from getting the vaccine. I'm just saying.
And again, you can find all kinds of not reputable sources out there to find, to hear all kinds of things. But thank you for kind of straightening that out. Kind of on the second. So what I'm hearing from you is that that there are symptoms at times, chills, again, pain, much like you would have in a lot of different shots. But these aren't typically things that knock people out, of work and that kind of stuff. Okay.
No, that's exactly right. If you expect them, and what we did was, because we thought in the first or second dose, and some people would have a reaction to them, we said, just plan on being, if you do have those, stay at home. If you have those concerns, just stay home an extra day. Take care of yourself. If you get a little fatigued, then bounce back. And that's how we staggered most of the first 1A the people in the hospital, they staggered their employees just in case somebody did have a side effect that was going to be disabling to them, that they couldn't work, had a headache, fatigue, those kinds of things. And people just don't feel good after they get a vaccine. And part of that is the immune system gears up to react to that protein. So you get a little swelling. Your body says, I got a little foreign body there. It's a spike protein from, they don't say it's a spike protein from the SARS-CoV-2, but they say there's something there that I should recognize. So it produces all these antibodies and immune system's response. So you get swelling and you may feel a little punk as if you had an infection, but you can't get the infection. It doesn't change your DNA, and you still can have kids if you want to have kids.
So, and I think that then kind of switches over to the other side, to HR and maybe even Margaret. I'm not 100% sure here, but for HR at least, I mean, again, things are in place. If someone doesn't feel well, I mean, they should just do their normal activation of a sick day or whatever in that way. That would be how we would support that. Is that accurate?
That is correct. Yes, that is correct. If they can go into the subsystem, they can call. I would encourage them to call their principal, let them know as well, but they can do that.
And a similar question just came in regards to, the idea that we're not 100% sure when these appointments will be available or whatever, what should we, what would we want to tell employees in regards to, if they're trying to get into vaccination, that might be something to talk to their supervisor about like, hey, I need to go do this. Is it okay for me to get a substitute or get coverage on that day, or what would you want to let them know about that?
I would say if you get the opportunity and you get the appointment, you go get the vaccination, regardless of the time of day. We'll figure it out, and we'll work with the principal to do that. So that's the priority.
And Margaret, so often, I mean, that is sort of the solution to a lot of these things, whether it's feedback for the district on different things or making arrangements. It's working with your school principal or department chair, right?
Absolutely. We definitely want our staff to be getting the vaccine, getting things taken care of. And the way to do that is talk to your building principal, talk to HR, and make sure that you're connecting. We're here to support and work with all of you to make sure that we're moving to a healthy situation.
I hate to belabor the point, but Stephanie, I just want to run down a few more that I got in the box while we've been talking. People want to know about classroom monitors, student teachers. Do we suspect that those all will be covered as part of this?
At this time, we do. Yep, I saw Mike give his thumbs up. That's what we're anticipating. Yes.
Because again, our interest is to make sure anybody that's working in person with students is getting taken care of here, because we want to keep our schools open. Okay, I appreciate that.
One thing I wanted to mention also is that what we've heard is that the vaccine appointment usually takes about 30 minutes. So people can kind of think through planning that as well if they get an appointment time that's during their work day. So factor in some, to and from, but it's about a 30-minute appointment because there's a bit of time at the end after the vaccine where you stay for observations. So that's just something to think about as you're planning that out as well.
Oh, I think that's super helpful. A question that we got that I think might be for Dr. Urbina, it's the idea of, how will the vaccine distribution work in Broomfield County? Of course, we've talked, Chris Campbell is representing the emergency operations in Boulder County, but we are hand in hand with, and you work for both. I mean, this is really what we're talking about today is applicable for both sides, for both counties.
That's exactly right. I think we're going to encourage people in Broomfield County to work with their schools as well. And so the same mechanism, if you live in Broomfield County, that same mechanism that Campbell talked about earlier in terms of working with the local providers to see how best they can get their vaccine in that community will be handled. And I'll share with Broomfield that we got that question today, and we'll, if we have any information that's different from that, I'll follow up with you, Randy, or the Superintendent Anderson. So. Okay.
Perfect. Let me triple pack one more question for you, Dr. Urbina. Just a couple, sort of odds and end kind of questions. One is, a staff member that said that they've got a 73-year-old and 83-year-old in-laws on the wait list, the COVID wait list. Will teachers be required to join the same wait list? My understanding from this conversation is it's sort of a different grouping. Is that right? Okay, I'm seeing
that's exactly right. Campbell alluded to this earlier, that we still have a lot of people in that 70 plus age group that are still waiting for their vaccines. So now you've layered another group beginning February 8th onto this, and it all depends on the availability of the vaccine. And I think the schools, Stephanie and your team, will be pulling this together and saying, how do we prioritize our group? That we're doing the same thing out in the community with the 70 plus. We're having multiple providers provide that vaccine. But again, the Achilles heel is there's not enough vaccine. So I think Campbell said this well, be patient. Hopefully we won't get 1,000 calls at midnight on February 8th. Saying, where's my vaccine and where's my appointment? I hope people can be patient and understand that we're, as Campbell said earlier, we're trying to get everybody the vaccine so that we can keep our schools open, as well as try to work within these priorities that we've talked about before. So I understand that this is worrisome, but be patient with us. The vaccine is coming.
All right, this is the last question. One more for our public health friends. And I'm just going to answer a couple of questions that we got as well as I do this. Again, can we get it at our primary care physician's office? The ones through us are going to be through whatever provider we have availability through. But if you can get it through your primary care, of course, do that. The question in regards to estimates on when children and teens will start getting vaccinated.
The clinical trials are now happening right now by Pfizer and Moderna. They just add another group of population on it. They're studying teens. They haven't studied children yet, younger than 15 to 18. So those are coming. But again, the issue is still we need to use the layers of protection that we've talked about multiple times. It doesn't matter what age you are, still protect yourself with all the layers that we've talked about as those clinical trials are being developed for children.
And Stephanie, last question for all of us. It's the idea of, charter schools are part of this as well. I mean, we were really trying to represent and take care of all of our in-person or student-facing people. So
yeah, we are including our charter schools as well as our child care programs. So all of the folks through community schools as well, Early Connections, our SAC programs, they're all considered part of us, and we're advocating for all of them together.
I recognize we're at 8:01, so we're over time, but I just did want to give an opportunity to any of our panelists. Anybody have anything that they feel like we didn't cover that you want to say? Not seeing any yeses. And Dr. Anderson, any last words before we leave today?
Again, just thank you. Thank you to everybody. Thank you to our entire community for hanging in there with us during this pandemic. Thank you to Boulder County Public Health, Dr. Bina, Chris Campbell, for being here this morning. As you can see from the slides, our folks our team's doing a great job. 40% may not be, the 70 or 90%, but in comparison to others, it's just a testament to the hard work that's happening in Boulder and Broomfield counties throughout this pandemic. They've stepped up to the plate. They're doing a great job. We care about everybody in our community. We care about those that are 70 and above. We want to make sure they get the vaccines. Those are our grandparents. Those are our community members, our neighbors. So it's important to understand that that's a priority for us as well. We want to make sure that we take this a community approach, and are excited on February 8th that we can begin to add our teachers as part of that vaccination process. And so hang in there, everyone. You're doing an incredible job. Really appreciate you. And thanks, Randy, for waking us up this morning to talk about it.
Well, thank you to all of our panelists. Thank you all out there that were joining us today for listening in. And I hope that you have a great week. Thanks for waking up with us.